Okay, good evening, folks. Discussion B is going to be discussing understanding chronic pain. For those folks who don't, I'm going to give you a little insight as to chronic pain and how we as pain management people treat that for folks. Okay, so please join me in discussion B, understanding chronic pain. Okay. Understanding chronic pain features a short video produced by Pfizer that highlights the widespread impact and complexity of chronic pain in the United States. Here's a breakdown of the key points based on surrounding content. Okay, what is chronic pain? Chronic pain is described as pain that persists without any clear trigger or warning, often continuing beyond the usual recovery period. It's not just a symptom, it can become a condition in itself, deeply affecting the brain and nervous system. Scope of the issue. According to the video, over 100 million Americans suffer from chronic pain. Underscoring its prevalence and public health significance. Recognizing the signs. The video aims to help viewers understand and detect the signs of chronic pain, which may include persistent discomfort or pain lasting weeks to months, pain that interferes with daily activities or sleep, emotional, psychological effects such as anxiety or depression, contextual insights. The page also features related health content, such as a segment on hip pain caused by osteoarthritis, suggesting a broader focus on musculoskeletal and neurological conditions. The conclusion of expert commentary, e.g., Dr. Bazam Mazari, adds clinical depth to the discussion of pain-related disorders. Would you like a deeper dive into the neurological mechanisms of chronic pain or how it intersects with frailty and aging resilience? The page entitled Understanding Chronic Pain features a short video produced by Pfizer that highlights the widespread impact and complexity of chronic pain in the United States. Here's a breakdown of key points based on surrounding context. Okay. Chronic pain is described as pain that persists without clear trigger or warning, often continuing beyond the usual recovery period. It is not just a symptom, it can become a condition in itself, deeply affecting the brain and nervous system. Scope of the issue. According to the video, over 100 million Americans suffer from chronic pain, underscoring its prevalence and public health significance. Recognizing the signs. The video aims to help viewers understand and detect signs of chronic pain, which may include persistent discomfort or pain lasting weeks to months, pain that interferes with daily activities or sleep, emotional psychological effects such as anxiety or depression, contextual insights. The page also features related health content such as a segment on hip pain caused by osteoarthritis, suggesting a broader focus on musculoskeletal and neurological conditions. The conclusion of expert commentary, e.g., Dr. Basman Mazari, adds clinical depth to the discussion of pain-related disorders. Would you like a deeper dive into the neurobiological mechanisms of chronic pain? Or how it intersects with frailty and aging resilience. Chronic pain management requires a multifaceted approach tailored to the individual's biology, psychology, and lifestyle. Here's a comprehensive overview of effective treatments, pharmacological treatments, medication type and use, case, NSAID, e.g., ibuprofen, naproxen, inflammation-related pain like arthritis or injury, acetaminophen, mild to moderate pain without inflammation. Antidepressants, docoline, and metryptyline, neuropathic pain, fibromyalgia, mood regulation. Anticonvulsives, like gabapentin, pregabalin, nerve pain, diabetic neuropathy, shingles, opioids like morphine, oxycodone, codeine, and severe acute pain or cancer-related pain. Topical agents like lidocaine, capsaicin, localized muscle or nerve pain. Then you have NMDA. Those are analgesics, like ketamine or those are for refractory neuropathic pain. Combination therapy is often more effective than monotherapy. And then you've got non-pharmacological therapies. Okay, folks. Non-pharmacological therapies, cognitive behavior therapy or CBT, reframes pain related thoughts and reduces catastrophic pain. Okay, mindfulness and meditation enhances emotional regulation and reduces pain perception. Physical therapy improves mobility, strengthens muscles, and reduces pain through movement. Okay, biofeedback teaches control over psychological functions like muscle tension and heart rate. Then you have acupuncture, stimulates nerves and releases endorphins, offering relief for some types of pain. Massage therapy reduces muscle tension and promotes relaxation. Advanced interventions. Spinal cord stimulation delivers electrical impulses to block pain signals. Nerve blocks, injections that interrupt pain transmission from specific nerves. Steroid injections, reduced inflammation in joints around nerves. Transcutaneous magnetic stimulation, or TMS, modulates brain circuits involved in pain perception. Lifestyle and integrative approaches. Anti-inflammatory diet, rich in omega-3 and antioxidants, and low in processed foods. Sleep hygiene, crucial for pain modulation and emotional resilience. Exercise, low impact activities like swimming or Tai Chi improve function and mood. Support groups, peer counseling reduce isolation and foster coping strategies. Whole person care models. Stanford's Pain Center emphasizes a whole person approach, integrating medical, psychological, and social dimensions of care. This aligns beautifully with your interest in system based neuroscience and frailty aware models. Would you like to explore how these treatments could adapt for memory friendly housing or smart smart elder care environments. Hold on, guys. Switch paper. These exciting potential. There's exciting potential for co-designing tech integrated pain management frameworks. There's a wave of innovation reshaping chronic pain treatment, offering new hope beyond traditional medications and surgeries. Here's a curated overview of the most promising developments. Next generation non-opioid medications. Suzette or Gervanex, recently approved by the FDA. Represents the first new class of pain medication in decades. Selective sodium channel blockers target peripheral nerve with fewer side effects than opioids. NMDA antagonistic drugs like ketamine are being refined for safer long-term use. Emotion focused therapies, pain and emotion therapy, a digital intervention that retrains emotional processing circuits in the brain. Uh, Participants report significant pain reduction and improved emotional regulation, delivered via video session and supported by self-guided tools. It's especially promising for neural or mobility limitation or limited populations. Sleep-based interventions. Sleep therapy. A new research shows that disturbed sleep increases pain sensitivity, especially in women. Improving sleep quality may enhance the effectiveness of other treatments and reduce reliance on medications. Neuromodulation and device therapies. Scrambler therapy, a non-invasive technique that reprograms pain signals, showing 80 to 90% rates. Ooh, genicular nerve radiofrequency ablation, minimally invasive and highly effective for knee pain in older adults. AI guided spinal cord stimulation, personalized stimulation patterns based on brain imaging and pain profiles, cannabis-based clinical frameworks, endocannabinoid system modulation. New clinical guides help tailor cannabis therapy using data-driven algorithms. Focus on CBD dominant strains and terpene profiles to reduce psychoactive effects while managing pain. Mind and body innovations. Virtual reality pain processing users immersive environments to retrain pain perception. EEG neurofeedback helps patients regulate brain activity linked to pain and stress. Precision medicine and imaging. Advanced brain imaging is being used to match treatments to individual pain mechanisms, non-susceptive and neuropathic or neuroplastic. Would you like to explore how these emerging therapies could be integrated into frailty-aware care models or smart housing environments? There's a rich potential for co-designing interventions that align with your systems-based approach. Okay, guys, so that is it. That is it for now. I'll be back on shortly with C. Give me a little bit for C, please, and I'll be back on with that in a little bit. For now, Gator Wellness. Take care, folks.